Nigeria is ranked second after South Africa among countries with highest HIV prevalence, with an estimated 3.4 million people living with the virus. A recent survey by the Center for Global Public Health reveals that commercial sex workers contribute largely to this figure due to lack of information about their sexual rights and preventive measures.
This study has shown that most of these women and men who visit these venues develop a sexual relationship, eventually go on to have sex without protection. They are exposed to HIV/AIDS. And most of them do not have even information on what to do about it.
There are other key populations like people who have men who have sex with men. There are people that inject drugs. There are other high-risk groups, but this is specifically limited to female sex work because they are more organized now. We can engage them with programs. They've come out that this is their work.
The survey, which also captured sexual networking centers and social networks, will allow government and relevant agencies to plan and strategize on ways to reach this category of people with appropriate interventions.
So there was a need to study these different groups and how those unique identities relate to the HIV/AIDS risk they face, either in transmitting or acquiring the HIV/AIDS disease.
Our plan is that we must reach these women with programs such as using of condom, going for HIV testing to know whether they are infected, and how to start treatment on time.
The survey, which focused on key populations in the urban center, is expected to be replicated in other groups such as PMTCT and among orphans and vulnerable persons. Alima Fashakin, UIT News, Abuja.